September is International Childhood Cancer Awareness Month. Now, around the world, children and families affected by this disease are remembered. The campaign aims to spread awareness on the early warning signs of childhood cancers. For more on this, I'm joined by Professor Janet Poole. She is the head of the Pediatric Oncology Unit at the Charlotte Maxeke Hospital here in Johannesburg. A very good afternoon to you, and thank you for coming in.
Good afternoon. So,
speaking today about raising awareness about childhood cancers, and just in some reading that I was doing earlier, a stat that came up a few years ago was that about 800 to 1,000 children are diagnosed with some form of cancer. How difficult is it to spot cancer in children?
It's not very easy because many of the signs and symptoms are not specific. But we have formulated the warning signs, the St. Silouan warning signs, which give an indication of what doctors and health practitioners should look out for and think about it in the back of their minds should any of these symptoms present for more than 2 weeks or more in a child who has one of these signs or symptoms.
But the complication, of course, here is that unlike the tips that are given to women, for example, with breast cancer, to say you can self-examine for lumps, in children, especially for the majority of South Africans who may not be aware of what the signs would be of a cancer in a child, how do we begin to bridge that?
Well, basically what CHOC is doing, what CHOC is the Childhood Cancer Foundation of South Africa, is they have a campaign to promote the early warning signs, and they're training a lot of people in the rural areas to go into the primary healthcare clinics to involve traditional healers and doctors at primary care clinics and at hospitals to look at the early warning signs. And when a child presents with something that may be in the early warning signs, then just to say, okay, maybe this child might have cancer. If the child doesn't get better from whatever symptoms they have, to actually think about it and then refer the child onwards.
Speak to us then, Prof, about the most common cancers that are found in children.
The most common cancer in children is leukemia, which is a cancer of the blood or bone marrow. And that really presents sometimes with a constellation of symptoms. The child may not just be well, just tired, anemic, a lot of bruising, maybe nosebleeds, and sometimes bone pain. And really just loss of weight, loss of appetite. So in combination with those kind of symptoms, it's important that the healthcare practitioner or doctor examine the child very carefully, because then they may pick up some other signs, like an enlarged spleen or a liver or something like that.
Children also battle a lot with tumors, I understand.
Yes, the most common tumor in South Africa is a tumor of the kidney, which is called a Wilms tumor, and that is the most common sign is that the mom or dad might feel a little swelling in the tummy when they bath the child, and it's always important to know that if a child goes to a doctor for any reason, just to feel the child's tummy so that they can pick that up.
I'm interested in, Prof, in the kinds of treatment options that are available to parents and their children, because cancer treatment, even in adults, is quite a brutal process. I'm thinking of chemo. How is that moderated to suit children?
Well, the children's cancers are much more responsive to treatment than in adults. In fact, we will go for cure. And for instance, leukemia, there's around an 80% chance of cure in the most common type of leukemia. And we do use chemotherapy. We use protocols that have been formulated overseas in multi-center trials. But obviously the doses and everything's adapted to the child's size. So we always work it out according to how big the child is.
And cost, how expensive is it to treat cancer?
The actual drugs are not expensive, the majority of the drugs. But the problem is most of the treatments, or the early treatment in most of the childhood cancers, has to occur as an inpatient in hospital. And that incurs a whole lot of expenses, as well as the blood and blood products that are needed to support the child, and all the supportive care, like antibiotics and fluids and so on.
You've worked at the Charlotte Maxeke Hospital. This is public health. Are there sufficient resources in our public hospitals in particular to be able to treat children as soon as possible and in the best way possible for their particular cancer?
The majority of children who come to the public hospital will get accepted into the children's oncology clinics. So all around the country, in all the centres, there are children's cancer clinics, and we don't have a waiting list. As soon as somebody says this child might have cancer, we accept the child, we do the necessary investigations, and then we start the treatment almost straight away. So the majority of children will get treated within a week or two of arriving. However, there have been shortages of some drugs, which is not from the hospital, the state's problem point of view. It's from shortages at pharmaceutical companies and that sort of thing, which does present a challenge. The other challenge is the number of beds in the hospital and staff to look after the children. But I think we do it to the best of our ability, and I don't think that any child who comes to the public hospital will get inferior treatment.
Professor Janet Poole, thank you so much for your time this Sunday. That was Professor Janet Poole, the head of the Pediatric Oncology Unit at the Charlotte Maxeke Hospital, speaking to us about Child Cancer Awareness Month. That is September. Well, to